This video shows the administering medications via a metered dose inhaler or MDI. So it is a handheld inhaler that uses an aerosol spray or mist to deliver a controlled dose of medications with each compression of the canister. The medication is then absorbed rapidly through the lung tissue, resulting in local and systematic effects. So the purpose is to treat and prevent bronchospasm and treat asthma and chronic respiratory diseases. So it is indicated for the treatment or prevention of bronchospasms in patients aged 4 years and older with reversible obstructive airway disease. Drugs administered by inhalation provide control of airway hyperactivity or constrictions. So the equipments needed are the following: inhaler device with medication canister, the spacer device, the facial tissue optional, the stethoscope, the medication administration records or MAR, and the pulse oximeter, it is optional.
So the first step is to gather equipment. Check each medication order against the original order in the medical record according to facility policy. Clarify any inconsistencies. Also check for the patient's chart for allergies. Then the nurse should know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered, as this knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Now moving on for medication preparation, move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Prepare medication for one patient at a time to prevent errors in medication administration, and read the MAR and select the proper medication from the patient's medication drawer or unit stock. This is the first check of the label. Next, compare the label with the CMAR or MAR. Check expiration dates and perform calculations if necessary. This is the second check of the label. When all medications for one patient have been prepared, we check the label with the MAR before taking them to the patient. This is the third check to ensure accuracy and to prevent errors. We can now transport the medication to the patient's bedside carefully and ensure that the patient receives the medications at the correct time. Before finally administering the medication to the patient, perform hand hygiene and put on PPE if indicated. So good morning, ma'am. I will be your nurse for today. May I know your name po? How about your birthday, ma'am? So, ma'am, pwede na ka-check lang sa inyong identification band? Okay lang? Okay po. Yes, okay po, ma'am. So, ma'am, wala na ba kayo allergies po? Wala ka, ma'am. So, ma'am, maghatag ko of metered dose inhaler to treat your asthma po. Okay po. Yes po, ma'am. So, mag-prepare lang po kadali. Okay po. Ako lang po ang notification. Okay, ma'am. Thank you po. Wait lang po. I'll be back. So the next step is to remove the mouthpiece cover from the MDI. To assure me that this has a cover here, I remove it. Is it there? And as well as the mouthpiece cover from the spacer. I remove the cover. There. And then now I attach both together and such. And then since this is a fairly large MDI, I shake it as this. But normally you wouldn't shake an MDI this way, like that. Next is to have the patient place the spacer's mouthpiece into the mouth, grasping securely with the lips and the teeth, and then have the patient breathe normally into the spacer. Next, patient should depress the canister, releasing one puff into the spacer, and have the patient breathe in slowly and deeply through the mouth. Then instruct patient to hold his or her breath 5 to 10 seconds or as long as possible, and then to exhale slowly through pursed lips. Then wait 1 to 5 minutes or as prescribed before administering the next puff. And after the prescribed amount of puffs has been administered, have patient remove the MDI from the spacer and replace the caps on both. Next, have the patient gargle and rinse with tap water after using an MDI as necessary, and clean the MDI according to manufacturer's directions. Next, remove the gloves and additional PPE if used and perform hand hygiene. Then document the administration of medication